Good evening. I'm Dr. Djoko, and welcome back to Pharmacy Talks with D. We've been talking about overdose in the U.S. and how big of a problem it is. And if you recall, during our last edition, we talked about the fact that in the United States, we have over 3.5 times more overdose deaths than anywhere else in the world. And according to the CDC, we lose about 130 people in the U.S. a day from overdose, which is about 1 every 11 minutes. That is huge. And I always believe that educating the public, conversing with people at home, is the best way to tackle this issue. We want to prevent people from getting there. And for that, I'm fortunate to have with me today Dr. Let me see, I get this right. Heidi Ginter. Dr. Ginter is the Chief Medical Officer at the Recovery Center for America in Danvers, and she's also an assistant professor in the Department of Family Medicine at UMass. Welcome aboard, Dr.
Thank
Ginter.
you.
Thank you. And I also do have with me the CEO of RCA, which is Recovery Center for America in Danvers, Mrs. Laura Ames. Welcome.
Thank you.
And I also have, finally, the Director of Admission and Utilization Review at the Recovery Center for America, Mr. Eli Napastek.
Thank you.
Welcome on board. So let me start by you, Mrs. Ames. What are some of the services that the RCA offers, not only to people in Danvers, but to the general population?
So Recovery Centers of America in Danvers is located on 75 Lindell Street in Danvers. We're a 207-bed facility that's currently licensed at 122 beds. We have 37 detox beds, or acute treatment services, referred to as. Patients come in, usually it's 5 to 7 days for medical stabilization and detoxification. And then we have 85 beds licensed for clinical stabilization services, which is that next level. They medically are stabilized and they go to our CSS unit, which is really to help clinically give them the tools that they need to be successful in their recovery on the outside. So our total program is about 30 days. And then we also have, after they finish the CSS program, we also offer outpatient services to patients, which we offer an IOP, which is an intensive outpatient. We have an extended day treatment, which is 6 hours a day, 5 days a week. And then we also offer general outpatient services to our patients. We do medication-assisted treatment, which is comprised of either Vivitrol, Suboxone, or methadone services.
Perfect. Wow, that's great. I've spent so much time talking about the statistics and how addiction is a huge problem in the U.S. So it's good to have a center like the RCA where people can actually go and seek the help that they need. So thank you very much for that. Now I'll turn to Dr. Ginter. My understanding is that addiction is a chronic disease. Is that the case?
Absolutely. One of the things that I think is so important to understand from the perspective of addiction as a chronic disease is that a lot of people are very familiar with diabetes, asthma, high blood pressure, other things that are chronic diseases where in order to get well and to have that chronic disease in control, you need to change your behavior on some level, whether it's following a different diet or a different exercise regimen. And then you also need medications often to help reduce your blood pressure, reduce your blood sugar. But there's also a part of it that's an inherited component that you don't have too much control over. And so we think about addiction in the same way. There's a component that's inherited, but then there's a behavioral component that is really associated with what the patient does, what they ingest, how it changes their body, their brain, and their chemistry, and that then leads to the chronic disease of addiction. The interesting thing about addiction is that it has the same type of response to treatment that other chronic diseases do. And I think a lot of people don't understand that because they think so much of addiction as a failing of the person with the disease rather than an actual disease process that has treatment that can actually effectively help people stop using, become sober, and enter into long-term recovery. So absolutely, it's a chronic disease, and it has outcomes that are equivalent to other chronic diseases.
I'm really glad you mentioned that, because I always have the feeling that people look at patients struggling with addiction, and they get stigmatized. It's like a failure of the person. Why can't you just help yourself? And if we have that paradigm shift where we understand that it's actually a chronic disease, hopefully that stigma will be pushed aside.
I think you're right.
And the patient will have the opportunity to get the help they need. Now, how does addiction happen?
So I have some, if it's okay to show some of the slides that I brought.
Sure.
One of my addiction colleagues, Dr. Ruth Potee, put together an amazing collection of slides that she shared. And so I like to use those to help explain sort of chemically what's happening, and then how that chemical change actually changes how a person behaves in response to a drug.
Okay.
So one of the things, up here you can see the most recent definition of addiction talks about the different components that I was mentioning. Number one, there's an inherited component. Number two, the environment in which somebody is experiencing their life. Traumatic events really make a difference. Also, the person's life experiences in terms of their exposure to substances. Many people start using very young when their brain is still in development, and that can completely change the trajectory or the direction that the brain actually develops.
Okay.
And then the other piece is, it's not a failing of the person, it's actually that the brain has been hijacked and taken over by these chemical changes, and the person is no longer in control of some of the things that they're doing. Their brain thinks that the most important thing is to get more drug, rather than doing things that people who don't use drugs think of as most important, like getting to work, getting to sleep, getting good, healthy diet, having good interactions with colleagues and work. So prevention and treatment totally works. So what I'll do is just go on a couple of slides forward and talk about, briefly, there's genetic components. Some people believe that up to about 50% of the likelihood of addiction is something that you inherit. So nothing you have control over, but that other 50% you really do. And so that's the piece that's important. The next slide talks about life experience, trauma. Many individuals go through horrible life experiences, not just trauma events like a broken leg or a car accident, but abuse as a child, or neglect, or lack of adequate housing or food or shelter or other things that would let you feel safe and secure growing up. Adverse childhood experiences really add up and cause somebody to have a burden of trauma that sometimes they can relieve by drug use. And people start using because it makes them feel better. So it's a functional response in the beginning that then goes awry. So the brain has this really interesting response to the chemicals that happen in drug use. The next slide talks a little bit about this special chemical called dopamine. I think this one is the most powerful one of all, because it really shows you that for a normal person who's experiencing the normal, healthy, do you mind going back one? The normal, healthy experience of what it's like to have a great meal, or what it's like to have a great interaction with friends. The dopamine level associated with that goes from a normal level, maybe of 100 to maybe 150 or 200. But an individual who's using cocaine or heroin or methamphetamine will have 9, 10, 20 times the level of dopamine associated with that. And what happens is your brain gets overwhelmed by that and starts to want that more than it wants sleep, eating, relationships. You want to seek that high again. Those changes, going on to the next slide, actually change how your brain responds to that chemical. And it changes what you want to do in your free time. And so one of the most challenging things is looking at the part of the brain that gets changed by these chemical changes also has connections to the front part of the brain where you make good decisions. And if somebody's brain is hijacked by addiction, they stop making good decisions because that part of their brain that got interfered with by these chemicals doesn't work right anymore.
That's right.
So one of the most important things that we do, and you can go to the next slide, is really try to help people get a drug-free period of time where they can be sober, be comfortable, have their suffering managed, and really get to the point where their brain is clear and it can start to heal and they can find their path to recovery.
That's great. That's amazing. And now that we've established, coming back before I move forward, coming back to the genetic aspect or the genetic component, does that mean that if you have a family history of addiction, you're more prone? And is there anything you can do any different?
It's such a great question. So a lot of times people are used to saying, well, you know, my grandfather has diabetes, so I'm at higher risk. I've got to be cautious about how I eat and my weight and my exercise. Same thing with addiction. We do recommend that families talk to their kids as young as 10, 11, 12, when you feel like you can have the conversation to just say, hey, we come from a family where mommy and daddy have addiction problems, and that means you have a higher risk. Our recommendation is that you don't experiment with drugs and alcohol. That's not really something that we want you to do. No vaping, no smoking, no marijuana, no alcohol. However, if you do experiment and you get into trouble, please come back and talk to us, because one of the things that also runs in families is the likelihood of recovery. And so if people go down the path where they get sick, they also can go down a path of getting well.
That's perfect. Thank you very much. So all is not lost. So even with the family history, we can still do okay.
Absolutely.
As long as we take the proper steps. Now, we've established that addiction is a chronic disease. I suppose, like any other chronic diseases, like you said, the diabetes and other ones, there's going to be a multifaceted approach to treatment. It's not going to be, you go in, you get an antibiotic, and you're done. So can you elaborate about what are some of the approaches that we will have to treatment of addiction?
Absolutely. So I think there are, almost you can think of addiction treatment in 3 different categories. One is changing the behaviors that are associated with the drug use. Another one is using medication to help change and reestablish a normal level of chemicals and hormones in the brain that led to some of these changes. And then the third part is probably the most important, and that's reestablishing connection with life. So the relationships, the parenting, the work, the other things that make you a full-fledged human being enjoying your life. We want to help you get on the path where you can do these things all at the same time. And so one of the things that's really helpful about being in a center, whether it's like Recovery Centers of America or any place where you can go into treatment, is we hope that there would be a focus on all of these things. Your physical comfort, so that you're not having that discomfort of the withdrawal symptoms. If people are feeling sick, they're going to run, and we want to make sure they're comfortable and can actually get through that initial withdrawal. The second piece is actually learning new behaviors. How do you go out into the world when your brain has been telling you, use, 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 and actually make a different choice to get to work, help my kids, make the dinner, you know, the things that you want to do as a person who's sober in the world. The next piece is really looking at what led you to use. Was it trauma? Were there things in your mind that are playing over and over that you need to have some help with? Is there mental illness? Did we forget at some point that there's a really strong history of anxiety since you were a kid that wasn't managed, but you found that using really helped the anxiety go away. So we don't want you to use anymore. We want to take care of the anxiety. But really looking at not only what's necessary for you, but also how do you involve your family? How do you involve the community around you to support you as a sober person? In the same way that you were trying to get your needs met as a person using, we now want to surround you with the help to get your needs met as a person who's sober in the community.
Perfect. That is great information for all our viewers out there. And as a pharmacist, I would like us to talk a little bit about the medication component of it. So it's a broad approach, but as far as medication, can you speak a little bit as to what kind of medicines are used, or what should people expect when they go to treatment?
So the first part of treatment is really detox, where we're using a variety of different medications to handle withdrawal symptoms. Some of those medications are specific for the drug of abuse. For example, if people are using opiates, there's so much heroin, fentanyl, oxycodone use. We will sometimes manage the withdrawal symptoms either with methadone or with buprenorphine. And buprenorphine is sometimes called Subutex or Suboxone, depending. We also use additional comfort medications. For those people who are coming in with either alcohol use or use of benzodiazepines or other sedative drugs, we'll use other sedatives that are longer acting, and we'll also use comfort medications to help manage some of that. So there's sort of medicines in the beginning of treatment are really to help somebody stay for the 7 days so that they can actually make a plan. It's really not the treatment of addiction, it's really the treatment of getting somebody captured to stay and make an addiction treatment plan. Block their urges, block their cravings, help them be comfortable. The second piece for both alcohol use disorder and for opioid use disorder is there are options for long-term medicine. So people who want to reduce their cravings for alcohol can use a medicine called acamprosate. They can also use naltrexone or disulfiram. Those are the 3 FDA-approved medicines. They work very differently. for people who are interested in reducing their cravings and reducing their use of opioids, you've got methadone, you've got the buprenorphine, Subutex, Suboxone, Subzolve. There are a bunch of different varieties.
Yes.
And then you've also got naltrexone as well. So naltrexone works not only for opioids, but also for alcohol. So lots of options if people feel like the behavioral treatment would really be augmented or made better by an extra thing, and that extra oomph is that medication.
Perfect. Thank you very much, Dr. Ginter. I can't thank you enough. And for people at home watching, please, you should all know there's hope out there. There's a way to get through this. You just have to seek the help you need. Now, we've established the addiction as a chronic disease. And we talk about, Mrs. Ames spoke of what Recovery Center for America is all about. I will now turn to Mr. Eli. So I had a mom who asked me, actually last Friday, she said her stepson had an issue, and she had no idea what to do. How do people get referred to the RCA? What should I tell this mom if she's watching us right now?
So we have a line that's really easy to remember. It's 1-800-RECOVERY. So if you call that line, we have care advocates sitting by 24 hours a day, 7 days a week that are going to pick up that phone and answer any questions that person may have. So they can walk through what levels of care the patient may be looking for. When you call our care advocates, they're going to go through that process with you. They're going to run your insurance, tell you, if you have a deductible, what it is, what it'll cover. If we don't take your insurance, we'll help you find treatment. We're not just going to say good luck. So we're going to try to help find you a bed somewhere that can help you.
Okay. And then now, have there been instances where, and what about if the child is underage?
So there are programs in the state that will help refer them to as well.
Okay. Okay. Perfect. Did you want to add something, Mrs. Ames?
No, I think
Okay.
Eli covered it.
Perfect.
Yeah.
Well, thank you very much. So if someone is out there and needs some help, please, can you remind me that number again?
It's 1-800-RECOVERY.
1-800-RECOVERY, 24/7. If you call that number, you have someone who can help you get the help that you need. And on that, I want to thank you again, Dr. Ginter.
Thank you.
Thank you, Mrs. Ames. Thank you, Mr.
Napastek.
I always said, I was gonna screw that name up, but I feel okay because I told him if he can say my name, I will say his name, and he was unable to say mine. So thank you for you all watching at home, and I'll see you next time, and we will be talking about what is life like once you get into the RCA. Thank you very much.
Thank you.